Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Fibroids. The most common pelvic tumor in females is fibroids. The most common benign tumor in females is fibroids. Fibroids are the smooth muscle tumors which are originating from the myometrium. Fibroids are present inside the myometrium. If they are present inside the myometrium, we call it as intramural fibroids. To begin with, all fibroids are intramural fibroids. Each fibroid or leiomyoma originates from single myocyte. So if it originates from single myocyte, it is called as monoclonal in origin. Fibroid is Fibroid is an estrogen or progesterone dependent tumor. The major growth of fibroid occurs in the reproductive age group, that is around 30 to 60 years. After menopause, the fibroid shrinks and the development is infrequent. If fibroid increases in menopause, then always it points towards the malignancy. Fibroid is most common in obese females, especially in hyperestrogenic stage. Fibroids are more common in females with early menarche, nulliparous women, and African American females. Females with polycystic ovarian disease will have increased risk of fibroids. Protective factors of fibroids. Smoking will inhibit aromatase enzyme and thus this decreases estrogen. Thus, smoking is a protective factor for fibroid. Physical exercise, pregnancy, that is absent ovulation, multiparity, and breastfeeding. All these are protective factors for fibroid.
thank you and thank you for watching.